A health share is a company that allows members to share with other members. So instead of this model of an insurance where it's creating a pooling of all the funds, and the funds are the big insurance company's funds. You give your funds, your premium to an insurance company, they pool it, and then they're the ones dictating where it goes and what happens with it. A healthcare sharing ministry is such that you have members that are facilitating, we facilitate other members cost sharing. And so what this essentially means is that it's a way to pay for those health expenses, but in a way that's able to say, we actually at Solidarity, there's all different types of models at it through healthcare sharing. But what we've done is we actually have individual bank accounts that each member has that are individual members, and we've developed a whole process to be able to have when a bill comes on in, and we work with the current billing system. So you can, as a provider, bill us directly using EDI, and we use the best in technology and in billing practices. And then what it does is that it takes the members' accounts that they've agreed to be able to actually say, okay, these dollars in these accounts are going to go to share with this member to be able to share those medical expenses. And so every year it's not this, well, I need to be able to, pool my funds, restrict these dollars from going on out, and then having another insurance company on top of that that's telling me what I can and cannot do. And it's called a reinsurance. And then another insurance company on top of that that's telling me I can't do that. This is the way the current insurance model works, where we're able to say is actually say, you know what, our members it's a community of people that believe that there's a better way to do healthcare, and this is what we've agreed to, and it's moral and ethical and affordable, and we're able to actually start to be able to say, here's when these dollars come in these accounts, when this bill comes on in, we're able to actually pay the provider. Either it works very seamlessly with we call it a explanation of sharing, where it goes to pay the provider. If you actually have paid out of pocket for it and need reimbursement, you submit the forms, and then we actually reimburse the members. So again, there's a whole system behind it, but it's built on a really beautiful infrastructure that's able to actually make sure that those sharing dollars, that there's not a fraudulent action either. These accounts, they can't be touched. These go towards the sharing dollars of the members. And this is where there's all programming that's a part of this, So this is where for us too, the accounting principles have to be high. And sometimes healthcare sharing has gotten a bad rap because of its inability of having maybe the standardized processes. And so some healthcare sharing ministries have had a black eye in the past as far as this goes. And I always like to say it's good to have really good processes behind what you're doing, because this becomes now a model that's able to start to be able to really, really fix and be a part of the solution of this medical insurance complex that we're fighting against.
I agree 100%. I wrote a book about it called Sickened: How the Government Ruined Healthcare and How to Fix It. And there's a 6-step solution in there. And one of the solutions is health shares. People need to start using health shares more.